what has the statewide response been from districts knowing that any student can now opt into distance learning?
It's been a good response. I think that when we announced that, there was a sense of relief. You know, clearly it's best for every student to be in a classroom learning. We know that that is when children get their best education, when they're with a teacher who's a professional. But we don't want to force anybody to do something they're not comfortable with. I hope that parents will get confident and comfortable sending their kids to school. Having said that, if you're not comfortable, if you want to start out distance learning before you get comfortable, then that's fine. And so it's been a good response by parents, teachers, districts. It kind of let the air out of the balloon a little.
And parents and educators are, of course, told to be patient, be flexible. At what point are employers going to be told that? You know, with families that need to go back to work?
Yes, you know, it's an excellent question. I think most employers are being as flexible as possible, but obviously business has to continue, and so most employers I know of are inviting office workers to come back, and the most important thing is that no one goes to work when they feel sick. That's the most important message. Do not go to work if you feel sick. Do not go to school if you feel sick. And then beyond that, you know, we all just have to have enough courage to go about our daily lives, but wear our masks and follow the rules.
And you say, you know, don't go to school if you feel sick. Some teachers expressing some concern about the honor system, if you will. What is the state doing to ensure a smooth transition in the moment that someone tests positive, someone has symptoms?
Yes. So later this week, we're going to be putting out a playbook, very similar to the playbook that we put out for childcare and daycare, and that's worked incredibly well. You know, we have thousands of kids that have been in daycare for months very successfully, and that playbook is going to spell out in great detail what to do if a student tests positive, what to do if a student shows up not feeling well, what to do if several students test positive. And so by the end of the week, we will spell all that out, and that is the kind of thing I think each week we're going to get out a little bit more information, and I hope that when parents and teachers see all these precautions that we're taking, they'll realize that it's safe to go back.
Have pediatricians addressed students that are living with grandparents or older relatives, higher risk relatives? You know, will they be told don't come into contact with them because that would put them more at risk in the school building?
Yes, so that of course is the greatest risk. I mean, thank God, fortunately, the coronavirus doesn't have nearly the severe impact on children as it does on adults, particularly older adults. And pediatricians are very clear about that. They're less worried about the impact a virus will have on the kids and more about the children transferring that maybe to grandma and grandpa who they live with. And so if parents send their kids to school and they have someone in the house who's older, they're going to have to take more precautions in the home to make sure that the children don't spread the disease to the older loved one in the home.
And what steps, talking transportation, the biggest issue, arguably all the superintendents are saying, what steps are being taken right now, the conversations being had to prepare them? I know some districts say absolutely no chance we can get any more buses. We don't have the money for that. What are you doing right now to be able to talk to them? And I know you said a week from now or so, that will be that topic.
So some of it is getting creative, and many of the districts, they put their plans in last week. Some of these plans were fantastic. They're going to do staggered arrival and dismissal. They're going to, some of them are looking into bicycles and scooters. Some of them are looking into walking the kids to school. Others of them are going to make sure there's a monitor on every bus. You know, you could put more children on the bus as long as you're certain that the windows are open and the kids all have masks on. So there's no one-size-fits-all solution. It's different for every district. We at the state are working very closely with the districts, seeing if we could bring more resources to bear. But this transportation will be a challenge, and we're just going to have to work through it one district at a time.
And I know Dr. Fauci was saying this week that he believes it is possible to reopen schools if guidelines are followed. He said for colleges too, testing before, during, and after. What different points within the next few weeks do you want to hit when it comes to test results? I know the goal is 48 to 72 hours for K-12.
Right, 48 to 72 hours. The really critical thing is every school has to have a reliable way to check the symptoms of everyone who goes into the classroom. Because, you know, even if you get tested on a Monday, you could see somebody on a Tuesday with the virus and yourself have the virus on the Wednesday. So the point is, we're going to do testing. We're going to have widespread testing in schools, among students, among principals, among teachers, on a continuous basis. We will be doing plenty of testing, rapid testing, so you can get the results quickly for the students. That's critical, so we can get them into quarantine. Even if you do that, there's absolutely no substitute for symptom screening. No one can be in the school if they have a fever, if they have a headache, if they have the chills, if they have a sore throat. And that's the thing we're really going to have to focus on, almost even more than the testing. That's sometimes we worry that people get too relaxed, a false sense of confidence if they've had a test. There's no substitute for symptom tracking, mask wearing, and hand washing.
And as of now, what can you tell us about what testing would look like in those situations? You know, are they brought to the school? Will there be more, you know, testing tents set up?
Yes. So the way we've said it is we're not going to clear a district to open for in-person teaching unless we are confident that everyone could get tested and get their results within 2 to 3 days. So we are in the process right now as the state of purchasing a lot more testing equipment. And in order for us to say, yes, you can go back to school in person, we need to know that everyone could have their test done and you have the results within 2 to 3 days. The actual swabbing will probably happen at the school, and then you'll have to wait a few days to get the results.
Okay, so parents and families wouldn't have to worry about, you know, I don't have a car, I can't get to testing.
Exactly.
Okay. And I think just the last question for today is just your thoughts, you know, where do you want to be a year from now? I think we can all agree this is going to be historic, and, you know, as the governor, as a mother, what do you want to see?
Yeah. First of all, I really hope we have a vaccine, because this is hard. You know, kids are losing out on not being in school. The anxiety level is high. So a year from now, I really hope we have a vaccine which allows us to deal with coronavirus as we do the flu. You get your vaccine and you can, you know, be rest assured. But even more than that, I want to learn the lessons from this so that we come out on the other side of it smarter. So for instance, we should never have snow days again, right? Like we can teach children electronically for a short period of time. We're learning how to do that. A lot of the technology we're using in school for distance learning can help us be better at personalizing teaching for kids. So we want to learn that way. What we're learning about infection control, we should stick with it. You know, constant hand washing and being cautious. In our economy, you know, we're seeing who got hurt the most in this economy. Folks who only have a high school degree, people who were lower skilled, women, people of color. So what are we going to do about that? You know, a year from now, I'd like to have a more equal economy where everyone has some skills or a credential or a degree so they can get a good job. So I hope that we're not just through it. I hope we've learned some lessons around how to be smarter and more innovative and more skilled so that Rhode Island is even stronger and smarter and healthier on the other side of it. The other thing we've really learned is for healthcare to be effective, it has to be widely accessible and in the community. You know, one of the reasons Rhode Island is doing well is because we're going into the community to do testing, into the community to do primary health care. Everybody has been able to have an access to a test, regardless of whether you're rich or poor, your immigration status. We have to keep that up. Public health depends on everyone having access to health care, and so we should learn that lesson and, you know, keep that up.
Do you have faith that we will get those rapid test results by, you know, end of August?
I do, but, well, look, let me say this. I do, and if not, then we won't open school. You know, it's really that simple. We're never going to open schools until we're ready, until it's safe. So we're going to work as hard as we can, I hope we will. I think we will. If we don't, we won't open school until we do.